Hey everybody, I am here to do an update now that I've had lumbar artificial disc replacement as well. So I am just over 24 hours post-op from the Pro Disc being done at the L3-4 level, and it has been done by Dr. Razzulli here in Los Angeles, California. I flew out here from Michigan on Saturday and then had surgery yesterday, which was Wednesday, and today is a Thursday. So anyway, that's all relative. To give you an idea, I did show up a few days early, got acclimated, did a couple fun things like Universal Studios, and then we brought the kids, and then I had surgery. So yes, it has been 24 hours since then. I'll kind of dive into that in a second here, but just to give you an update on my neck, since I'm actually doing a video right now. Here's a scar, and you can see that it's very minimal as far as range of motion in the neck. It's really good. I'm still very active and leading an active lifestyle. I love fitness, so it is something that I have kept up despite having the neck and the back injury. I've worked my way around those things. As far as neck pain that I ever get, the only thing I really ever get is stiffness, which, I mean, that is more of arthritic. Anytime you have something done to a joint, be it hip, knee, neck, it's never gonna feel exactly the same. So I have days I'm more tight or sore than usual. Sometimes if I do more shoulder to overhead work or something, I just, the muscles tend to pull on my neck a little bit more. It's nothing about the migration of the disc or such. It's just more of that tenderness coming from just being more stiff in my neck from having that done. But honestly, I've got nothing negative to really say about my neck. It's been very good. I'm a little short of breath because right now it's hard to take deep breaths because my belly is bloated. So a little bit just quick so you know what happened with me and my lumbar in 2016, somewhere in there. I herniated my disc at that level. And then I tried to rehab it many ways, similar to the neck. Ended up being able to withstand it until I was literally bone on bone. So I've been bone on bone for quite some time now, well over a year. There was literally nothing left there. So it was fusion was the recommendation by my doctor, who even did my neck. He told me that there was no such thing as lumbar artificial disc replacement, and that maybe that's something I could look at overseas, but it was far too dangerous. And so my husband and I decided to be our own advocates, started to research it, joined an awesome Facebook group, which hopefully some of you from that group will see this video, and started researching different options, went through miles of red tape for insurance approval. Long story short, we ended up having to, my husband got a new job, very blessed, and his insurance approved it here in California. So we went with Dr. Razzulli, but before that we had Priority Health out of Michigan. They would not approve it. They approved fusion, a discectomy, which would do nothing since I literally had like no disc even left. It was just, they were quick to approve all the wrong options that would just lead to future surgeries anyway for me, but would not even consider looking at the lumbar artificial disc replacement. So we couldn't even fight the fact that it was being denied. They had all this red tape up surrounding even letting us approach them with it. They wouldn't even put it on the table. So anyway, we got approved. We're here. Kind of long story short, what this looked like for someone who's coming from out of state, just so you're aware, you have to get an MRI, a CT, your blood work, a urine analysis, things like that will need to be done at home. You're gonna send all that stuff over to Dr. Razzulli, a few weeks ahead of time so that he has that ready. I never met with him in person, but I did have a phone call with him. At one point, he called me personally and pretty much got here in California. I did have a meeting with the vascular surgeon, who was Dr. Wagner Willis. Hope I'm saying that right. Just real quick, went in there, had a small scare I might have a UTI. So they did a quick ASAP test, which came back negative. So be forewarned, please do the urine analysis, because if for any reason you do, that will cancel your surgery. But luckily it was negative. Also, don't take fish oil. That's one on those lists. The guy next to me in the recovery room literally was all ready to go, and then he made mention he took fish oil, and they booted him right out because I guess that thins your blood. So no fish oil. So met with the guy who's going to do the approach through the abdomen, who is your vascular surgeon. He was just very brief over what he was going to do, what the incision was going to look like. I'm happy to show you kind of where I'm at with that right now. So it's about 6 inches long, and there's a Band-Aid around it, but it pretty much goes down around my navel and down. Very bloated and distended right now. Just be forewarned, coming out of surgery, you're gonna feel lots of pressure both in your back and your abdomen. So I went into the surgical center. The nurses there are amazing, super nice, wanna make you comfortable. They go ahead and check, make sure you're not pregnant if you're a female, get your IVs in, all set up. The anesthesiologist will also call you the day before, but also meets with you that morning. And then soon enough, you're wheeled back and it's taking deep breaths and you're out, and then you're waking up. How that felt initially for me was I was bone on bone, so I did not have much disc height there at all. So the distraction pain was definitely there in my left quad specifically, where I was having nerve pain there anyway, but it was just very much amplified. And then of course my back felt like someone had taken a hammer to it, and my incision pain was very minimal at that point because they had the block going. So that's the great thing, is I really didn't have a lot of frontal pain. It was mostly just some of that distraction pain from being jacked up so far. And then my back actually hurting from them inserting that disc. But I also went in telling them I wanted minimal narcotics because I do not react well to them. So we were trying to minimally manage it as much as possible. I did get nauseous, which I kind of figured I would. I was unable to eat, I was unable to pee, and you have to do all those things before they'll release you. So I was there a lot longer than some of the other people. Just be forewarned, with Dr. Razzulli, you do go home. It's an outpatient procedure. So I'm here at an Airbnb right now. I'm standing up. I don't have my brace on right now or anything, but you will go home with one. I've walked probably a few miles, about a mile yesterday in the evening and about 2 miles today, broken up with the back brace on. So far, so good, except for nausea, which is tricky because if I feel nauseous, I can't take pain meds, but then if I don't take pain meds, I feel like I'm in pain. So we're just trying to figure out that balance and trying a few more things. But if I were to rate kind of where I'm at pain-wise, I would say that the block has now worn off the front part of my incision. So my abdomen is very painful right now. B, just expect that. It's gonna feel that way. You won't go to the bathroom. You won't have a bowel movement for 2 to 3 days. It's hard to pee, and there's just a lot of inflammation going on. So you're gonna feel uncomfortable, and it's normal. My back feels better than it did yesterday, and the nerve pain is getting increasingly lessened every time I walk. Walking has helped tremendously with that. So I know it seems crazy to be up and walking, but it has helped me a lot. So I'm not sure if I can answer any questions just yet about anything more than kind of what the first 24 hours has been like and what pre-op was leading up to it. That's kind of how it was. A lot of people had said to me when they saw my MRI and my CT scan that my bones look soft because I have what is like edema in there. But actually, I'm not sure how to say it perfectly, but the sclerotic, or it's SCELORTIC or something like that, that hardening of the bone is actually better for your disc. So for those people who are saying, that it wouldn't work for me, actually Dr. Razzulli said it was good that my bone had been hardening and thickening for some time like that, because it's better for the disc to be implanted in. So my spine looked good. I had scoliosis because I had completely collapsed more on the left. The right had a little bit of disc left, and that had led to a curvature of my spine, which I never had. So he was able to correct that. And that's pretty much it for now. I will do an update in a few days and let y'all know. But for now, I'm in California and it's pretty, and I'm from Michigan and it's snowing and everyone has the flu there. So either way, I feel lucky. I have a new take here on life and look forward to recovery. So if you have any questions about my journey, feel free to comment and I will try to answer them. But so far, so good, 24 hours post-op.